Hello everyone, I am Sanchika. I am from ECHO. Welcome to this webinar on Sipher ECHO webinar on good, replicable and innovative practices of tobacco control in India. Today's topic is topic number 13 and the name of the topic is Building Capacity of NTCP Officials for Advancing Tobacco Control in India. Our chief guest for today is Dr. Mira Aghi from RHRDE Research Advisory Board, and our presenter, that is subject matter expert, is Mr. Mukesh Kumar Sinha ji, Executive Director of Voluntary Health Association in Madhya Pradesh. Welcome to everyone.
Thank you. Thank you.
Now, I would request Mr. Arun Verma, who's the Director of Finance and Operations, for welcome address.
Thank you, Dr. Sanchika, and good afternoon, everyone. I am Arun Verma from Team Sipher. Yeah, on behalf of the organizer, who is a Sipher, ERCTC, PJMR, and ECHO India, I extend a very warm welcome to our chief guest, who is a highly respected and a very well-known behavioral scientist and a communicationist. She is also an expert member of the RHRDE Advocacy Board. Mr. Mira, we are extremely grateful for being with us as a chief guest in spite of being very, very busy schedule. I also extend a delighted and a hearty welcome to our speaker of the day, who is an expert on this event, Mr. Mukesh Kumar Sinha. He is an Executive Director with Madhya Pradesh Voluntary Health Association. You are welcome, sir. And we are extremely grateful to you for agreeing to present, make a presentation today. I also welcome Dr. Aghi Gupta, who is a president of the Sipher and who is a key person to organize all the programs in association with the ECHO India. I welcome Dr. Sonuval. Probably he hasn't joined so far. I also welcome Dr. Sanchika Gupta, who is a manager with the ECHO India and who is a force behind organizing all these programs. I'm an eminent participants and public health students. Today, we are here to focus on an essential aspect of the national program of tobacco control, which is a capacity building. As we all know, capacity building plays a crucial role in empowering the officials working on this program with the knowledge, skills, and resources needed to effectively carry out their responsibilities. It is likely to equip them with the tools necessary to make a lasting impact on the tobacco control in the country as a whole. By the end of today's event, I am sure the knowledge going to be shared by our expert of the event, Mr. Mukesh Kumar Sinha, will give us a deeper understanding and importance of the capacity building for officials working in this program of Government of India, which is very well needed to make a visible change and impact in this society. I once again welcome all of you to this program, and now over to Dr. Sanchika.
Thank you, sir. Now I would request Rajiv ji to discuss on the objective of the webinar.
Yeah, thank you, Dr. Sanchita, for this opportunity. As a background, Resource Center for Tobacco Control and the Department of Community Medicine and School of Public Health, PGH Chandigarh, organized a national conclave on best practices under NTCP in India. The aim was to compile the various initiatives undertaken by the state, document them, and a national and subnational with the respect to empower an NTCP for effective implementation of tobacco and nicotine control. A total 25 best practices in tobacco control from the various states of the country have been identified as a best practice due to their positive outcome in strengthening of tobacco control in specific region and the community. Sipher was the collaborator in this event, and these are the case study cover almost various areas related to tobacco control and advancing leadership management in tobacco control in India to changing tobacco taxation policy and tobacco product in India, so that the range of best practices is coming from the grassroots level till the top level. So the presentation by the expert will contribute to increasing the awareness and facilitating the cross-learning among the stakeholders and ultimately strengthen the national tobacco control program in the country. So this will sensitize the stakeholder to the best practices that can be replicated in other states. So today's presentation is focused on a building of the capacity of NTCP official for tobacco control in India and by the expert, Mr. Mukesh Kumar Sinha ji, Executive Director, Madhya Pradesh Voluntary Health Association, MP. And we honor to have Dr. Mira ma'am also as a chief guest today. So thank you again. And this is just a background of the event. So I request now Dr. Sanchita to invite our speaker of the day. Thank you.
Thank you, Rajiv ji. Now I would request Rakesh sir to introduce our chief guest for the day, Dr. Mira ji. Sir.
So welcome, Dr. Mira ji, and everybody in the audience, they know about her. She's a behavioral scientist and a communication expert of international repute. She has served as a consultant or advisor for numerous global health organizations, including WHO, International Union Against Tuberculosis and Lung Diseases, IDRC, UNESCO, and UNICEF. Her outstanding work as a researcher, community health educator, and advocate to prevent tobacco-related disease has been honored by numerous awards, including the International Network of Women Against Tobacco, Tribute for Outstanding Service for Women in 2009, and Luther Terry Award in 2012. Society for Research on Nicotine and Tobacco honored Dr. Mira's esteemed journey in tobacco control by initiating Mira Aghi LMIC Research Award. And Dr. Aghi also holds a PhD in psychology from Loyola University, Chicago, US, and she's mentor to almost all of us in the audience. So thanks a lot, Dr. Mira ji.
Yes.
So we'll ask you to please give us some opening remarks on the presentation.
Well, I think that you have chosen the right person for this for today's program. Dr. Sinha is a very well-known, esteemed, professional in this area. And what he's going to talk about is of great significance. He's going to talk about the various people who are involved in tobacco control, how they are trained, what their backgrounds are, and how they are trained. I think that, people will, all of you should pay great attention to his, the type of training that he is talking about, because the training that he is talking about is involving people right from the beginning, which I have always promoted as a behavioral scientist. So this is enough to start with, and I'll come later on. Okay?
Okay, thank you, Miraji. So over to Dr. Sanchika, please.
Thank you, sir. Now moving to introduction of subject matter expert, sir, today. Mr. Mukesh Kumar Sinha ji is the Executive Director of MP Voluntary Health Association. He is responsible for execution of all the affairs and activities, including day-to-day administration. He is also an ex-officio member of the governing board and one of the signatories of bank operations. He is a postgraduate in social science, assistant for post-graduation in rural development from Xavier Institute of Social Services, postgraduate diploma in human resource management, and also leadership management course from Johns Hopkins University. Thank you, sir, for joining us today. Over to you, sir.
Thank you so much. Good afternoon, everybody. I'm really grateful to all of you for providing me this wonderful opportunity to speak about the topic which has been given to me. You see, I have added one thing. Building capacity of NTCP official was my topic. I have included two words: building capacity of NTCP officials, NGOs, and CBOs for advancing tobacco control. That is, there's something hidden objective was there, because there are only two social laws. One is the PCPNDT, Preconception Prenatal Diagnostic Act, and this Tobacco Control Act, where in official capacity NGO can do something, even monitor, even enforce, do the enforcement of law also. Are you getting my voice?
Yeah, Mukesh ji, your face is not fitting into the frame. Can you just move a little down? Yeah.
Yeah.
Yeah, no, I think it's better now. But can you move a bit down? Yeah. Now it's okay. Thank
what
you.
to do the furniture which has been provided here.
No, it's okay, otherwise. Thank you.
Anyway. So that is why I have included NGO and CBOs both, apart from NTCP official. The reason is that if you go and talk to the government officials, you have to be very smart and you have to do a lot of homework. I'm just, before presenting my PPT, I'm just giving you an idea. If you are visiting to the principal secretary rank officer, you get hardly 5 to 6 minute times to speak about it. If you go to the technocrat, you may get 20 minutes time to discuss with whatever you want to say, you can speak to them. If you're meeting to the collector, then again, the concentration of the district collector or DM remains only 4 minutes with you, although you can sit there for 10 minutes, 15 minutes, because he has other work to do. And if you are working in the community, you have a different approach you have to adopt to attract these people. And when you are visiting to the political people for advocacy or capacity building, then your technique should be quite different. And that is why I have prepared this presentation, and I said, okay, training of NGOs, CBOs is equally important along with the officials. Next slide. Next slide, please. You see, I will start with the nomenclature and understanding. Reason, every day means every week we are attending so many workshop, meeting, trainings, and other programs. And I'm always confused, being a worker in the social field or trainer or whatever. I always confuse whether it is orientation or training program or sensitization program.
Mukesh, are you with us?
By orientation workshop, right? What happened?
No, it's on. Audio was muted.
Now, nomenclature, I will start with the capacity building. Because technically, capacity building is a very huge exercise. This involves not only building in terms of providing the training, but you have to build the abilities, perspective, skill, process, resources for the organization. And just the purpose is capacity building so that you can make the enterprises more effective. You can make the individuals, those who are working there, you can make them more efficient so that the results can be brought in a very systematic manner. And that is why we go for a capacity building. But when we go for a training program, training is always related with the transfer of skills and knowledge. Under the training program, this is one part of the capacity building program. And that is why without understanding this, we are holding so many programs, giving the name of training or orientation or capacity building something. Then capacity strengthening is something different. This is an ongoing process. We build the ability of the individual working in the organization. And that is why strengthening is a highly skilled job of the trainer. Dissemination of information, knowledge participation, transfer of skills, and capacity strengthening is a big task, is a very, very big task. Now, next is the sensitization. Sensitization is another word which I am using. Basically, we sensitize the people for their reaction. You can judge very well whether the person has been sensitized or not if you have a long discussion with them, or you are holding a orientation program, or you are holding some dialogue with them, or doing advocacy. If the person is not ready to react, or if the person has reacted directly or indirectly, it means he or she has been sensitized. And learning is a continuous process through which we learn, and it is a gradual process, makes you new. Every day when you learn, your behavior will change. If you learn something new, your action will change. If you learn something new skills, your reaction will be different. And education is something different which we have done from class 1. It's a highly structured exposure to planned learning. And planned learning, why I have used the word planned learning, because learning can be through a structure, or can be through observation, can be through discussion, can be through different methods, can be through interacting with the people. So that is why education is different from the ordinary learning process. Next slide. Next. Why we organize the capacity building program, training program, sensitization program, learning, education, all these programs? We want change. We want change. We want to bring changes in the behavior of the individual. And this is only possible when we go through the plans. I'm talking about in respect to the tobacco control program in this area. Because changes are taking place by two methods. There are two ways through changes can be done. One is the planned method, another is the unplanned method. Accidental changes do not have a sustainability. That can be done for a certain period, but it cannot bring entire changes in the society or in the country or in the community. If you proceed with the planned change, then it will be a very systematic and you can achieve in a very scientific manner. Somebody died because of the tobacco, maybe the family member can leave the change, stop the using the tobacco. Other brothers and sisters, they may stop the using the tobacco, but this will remain up to one family. But if you use in a planned way that this person has suffered because of the use of tobacco and he or she has lost her father or his mother because of the use of tobacco, that the best example is voice of victim exercise. That is also a planned change. It's not accidental change. So change is always in the tobacco control field. We go with the very systematic and planned change. Next. Now, accordingly, now once you understand that are you going for a capacity building or sensitization or transfer of skills or knowledge, then you set your target also. Then you finalize your strategy also. Then you give the innovation in the entire effort also. Like when we visit in the policymakers is the best example. We know we are not going to transfer the skills and knowledge to them, but our main objective is to meet with the policymakers to sensitize them. And for sensitization, what is required? What input is required? If you go the sensitization for the bureaucrats, they are very senior people. They are educated person. They have gone through the Union Public Service Commission. They remained as a collector. They work as a ADM or SDM. So they have all information within them. What is required? The reliable information and a strategy. The bureaucrats, normally they look for the
Mukesh, your frame is frozen.
Information, which is the source from where you give me a reliable information to us from which source you have collected this information, number one, and then you suggest us the strategy. The bureaucrat will be happy. So you have to design this. But if you are visiting to the political person for doing this advocacy or any exercise, then you go with the number. Politicians are always interested in number. How many people are going to be benefited? How many people will be impressed in my constituency if I do this tobacco control program or any RCH program or any women health program or adolescent program? So they are more concerned about the numbers. Bureaucrats are more concerned about the reliable information and strategy. Now, who is going to do the enforcement in the field? It is the field level worker. It is not the collector. It is not the secretaries. It is not the higher authority. It is the field level enforcers. They do the enforcement of tobacco control program. So for their training should be different. So we provide knowledge and skills to them. It is not just orientation about the BEAR Act, about the Cigarette and Tobacco Act. How a drug inspector can frame the charge, that skill is required. Whether the drug inspector is eligible to frame the charges, putting this act, JJ Act of 77, Section 77 of JJ Act, no. The drug inspector cannot frame the charge by giving putting this section 77 section of the JJ Act. No, he is not eligible. The second example we give why in this country the the cases against the section 5 is very poor is because the person who files the case against section 5, he or she has to appear in the court whenever there is a hearing in the court. It doesn't go with the designation. It always goes with the individual individual who has filed the case, and that is the biggest drawback. So the best training part is that you transfer the knowledge and skills both, so that somebody is doing any enforcement at the site, they can decide how to proceed, how to involve, whom signature to be taken, and what are the documents to be submitted in the court to win this case. So the knowledge and skills are required for the enforcer. If you are conducting a training program for district nodal officer, they require all. They require sensitization, knowledge, part skills, resource informations, directives. They also require DNOs because they are from the they are technocrats from the department. So they need information related to resources also. Then public awareness. If you go for a public awareness, then there are various methods how to capture this. Now these days, Dr. Rakesh, you are champion in this. This is these days WhatsApp and other Facebooks and other things are cropping up gradually, and people are disseminating information through these instruments also. So we have to understand which target we are going to train in which using which tools. Then NGOs, CBOs, serious implication. We have to make understand to the NGOs the enforcement, because they are not competent enough to do the enforcement. They can only help the enforcers to go for the enforcement. So seriousness of implication training for the NGOs and what they can do, their role is very important. Similarly, if you talk about with the technocrats, then they require three things. We have to understand. One, they need, because they are technocrats, they have gone through the study and everything. They need a platform where they can make a presentation. Whatever they have done, they can share the case studies. They can disseminate the information. So they want that they should be used as a resource person. If I'll quote the example, Dr. Gupta is sitting here. Dr. Gupta is a very good presenter. Dr. Gupta from Rajasthan and Chandigarh both, they are very nice. If they are not supposed to get the training for the enforcement, and we are not expected to take them for the enforcement, but we have to learn from their experience. They are academician, they understand, they have a good understanding about the subject and laws. So that part is required from the next slide. Next slide, please. There's a lot of disturbance. Sometimes the waiter is coming, sometimes the visitor is coming. Anyway, I will continue. Now, why training in tobacco control is required? I list bother about the workshop. Workshop has a limitation that when you hold the workshop, you just sensitize the person, and most of the people we are sensitized. Now, why training is because if you go to any department, you will not get a ready-made employee there. You will not get. Even the officials, those who have gone through the induction training at the Missouri or at the state administrative service, even the doctors who have done their training at the medical college, not necessary that they know everything. And that is why this training is required, number one. Second is the society is dynamic in nature. Today we were discussing, Dr. Mira was there. There are external and internal forces. External forces is related to the policy. There's a frequent change in the policy. There is a frequent change in the directives. There is a frequent change in the decisions taken by the courts. These are the external factors. Then international decisions, treaties, which are coming. Internal forces are also there. Technology changes are there. Staffs are shifting here and there. Many consultants are resigning, new consultants are coming. So the society is dynamic. Similarly, the entire department is also dynamic in nature. Today, the IAS officer which has been oriented and trained, tomorrow he may be transferred. Or the official, those who have been trained may be transferred. So change in technology, change in policy, change in laws, change in needs of the people. Because of these changes, the continuous training is required to these people to make them a stable force. Otherwise, all the time we will hold, we will expect the result. Then people's understanding and movement also. This is very, very important. This is very, very, we think from one side that whatever training we have given to the person, now he is capable enough and he will do everything. No, it's not. Sometimes we have to understand the perception of the people. We have to understand the behavior of the people. We have to understand the tradition and culture of the people. We have to understand in what condition they are reacting. If we have this type of understanding, then we can create a movement in our state related to the tobacco control also. Next slide. Next. Now, normally what we do is my practice in Madhya Pradesh. I have trained all the. We go with a very highly participatory approach training. We involve all the, these are the nodal officers and police officers. They are involved in this training program. If you are making a presentation and speaking well, this is not going to help you, because most of the participants, after 45 minutes, 1 hour, what they will do, they will watch the mobile, or they will send the SMS, or they physically they will be there, but they will be diverted, because the government officers, one officer has been given a 3-4 charges. Is a normal condition. So it should not be a mechanical training. It should be a very thoughtful training. You have to build up the perspective of these officials. You are supposed to transfer the knowledge also. You are supposed to transfer the skills also. So various methods are expected from a trainer to be used if you are going to train them fully. Second, training should be very innovative. Last time what training you have conducted, if you are going to repeat the same thing, they will not take interest. If the participants are same, if the trainers are same, they will not enjoy. All the time, new innovations, new approach, new things are required to inject the idea, knowledge and skills both. And that is why we involve many things. We involve case studies, games, quiz, leadership, monetary, team building, promotional exercise. So many exercise is being done. And that is why I always say that training cannot be done within 1 hour, or within 2 hours, or within 4 hours. Within 4 hours, you can disseminate the information, you can sensitize the person, but you won't be able to transfer the skills. If you want to transfer the skills, then you have to spend 1 or 2 days time, full time, to get the skills. Next. Next. Then when you go for a training program, any training, whether it is agriculture or tobacco control or health training program, the ready reference kits are required, tools and methods are required. And you have to develop these tools. Like ready reference kits, we have developed for the sensitization of the policymakers. The content is quite different. The message is same, but the content is different. Training manuals for the law enforcers is a slightly elaborated exercise. Handouts for making the awareness, field level examples, demonstration, displays, you have to develop prior to conducting the training program. And pre-testing and post-testing exercise is very, very important. We go for a pre-testing exercise and we see whether after conducting the training program, if the post-test, if somebody has replied the answer of 10 questions earlier, and you have 30 questions, and after conducting the training program, if the participants are going to give the reply of 25 questions, it means something which has been transferred to their knowledge. So this is very, very important. Tools and methods, how this needs lots of thoughts and exercise. Page wise, one cover page looks very attractive, but inside lots of thoughts and objectives have been given. Next slide. We are very clear. Once you conduct the training program, you set the goal. Like these are the 6 departments which are very, very important for tobacco control in India. Although all the departments are very important, but presently, since we are dealing with the National Tobacco Control Program as well as COTPA 2003, and therefore these 6 departments are very important. We conduct police training program for police regarding enforcement. We total content, total knowledge, total skill is being transferred to the police for the enforcement. But for the education department, our priority is something different. We do not train them for the enforcement because the teacher or principal cannot enforce much. We train them for tobacco-free institutions and about 6A and 6B, even 5.3 also. 6B and 6A, again, the school teachers have limitation. They can act within the premises, but outside premises, they cannot act. They cannot fight with the shopkeepers. They cannot fight with the shopkeepers in front, the shops which are in front of their school. Then what they can do, they can inform the administration. They can write a letter taking signature of the students' parents. They can send this letter to the officials, municipal corporation or administration. So this type of training you have to train how to draft the letter, what signature to be taken by whom or from whom, and to be sent to which person. This training they require. Municipal corporation, we conduct training programs related to the vendor licensing 4, 6B and 5 for the municipal officer. All the things we don't inject to every department. Otherwise, they will confuse. Panchayat focus on the COTPA as a whole. Health focus to ensure implementation and coordination with different departments. The health department has to learn first how to coordinate, because they health-wise they are medical doctors. They know tobacco is harmful. Why to waste the time conducting this training program to the health department? Even nurses, even the paramedics, they all know ill effect of tobacco. But most of the time we are conducting the training program. We were conducting the training programs related to health. 13 lakh people are dying. It is causing cancer. It is causing COPD. It is causing this, because they know. They already know. They require how to coordinate with the other departments, how to follow the protocols, how to attract the other sections of the society to contribute for the health promotion in the state. That sort of training is required for this health department, and we do conduct for them. And there's a separate chapter. And for administration, directives, monitoring, enforcement, review, and other supports. We sensitize them because their role is to issue the directives, do the monitoring, strengthen the monitoring program, ensure the enforcement in the districts, reviews. They will say how, on what point we are going to review. You train them to develop the indicators. You train them to about the laws. These are the indicators of the laws. You have to find out this. You do the review on the basis of this. So these are the different training programs which we are conducting. Next. Now, purpose. I have already spoken. If you want to build a movement, then you have to train the NGOs and CBOs, because violation and everything will be reported by the CBOs and back. Can you go back? I've given the purpose, like capacity building of NGOs. Why capacity building of CBOs is required? Is because to build the movement for local advocacy. All the time, the trainer will not go to the district. It is your people, those who have been trained at the grassroots level, on behalf of you as a trainer, they will perform their responsibility in the district. So that is why we are conducting a series of training programs for the CBOs and NGOs, which is lacking in the entire tobacco control program. We are mostly focusing on the government officials. To activate the government officials, to motivate them, to keep the school teachers motivated, this cadre is also required to be trained. Next, ma'am. Involvement of civil societies. You see, best example, none of the schools in the country, they cannot come forward of their own. It is the NGO sector, it is the civil society. They motivated the school teachers and principals to go for the yellow line. And once they were motivated, they involved the students, teachers, parents also for the yellow line. This is a best example. It is a Kerala VHA, UP VHA, and other NGOs. Rajasthan has done extremely well. The teachers were motivated with the help of the civil society initially. And technocrats are supposed to give the correct information and correct knowledge. So we have to combine both. Dr. Gupta, I would like to highlight, other than this, why the tobacco control program is not gearing up well. It's already very well, because we have not been able to form a team in this country till date. Academicians that I was discussing with the medical college people, they have done a lot of research work. They are very good presenters, but they are not allowed to go to meet the collector or the secretary health because of the protocol. The professor will submit, a reader will submit the reports to the dean, and dean will submit to the, because they have to maintain the protocol. A medical officer cannot go to the secretary directly. And it is happening. Even I'm 3-4 days back, I was there, All India Institute of Medical Science. I was discussing with the Pankaj Bhardwaj also. I said, Bola, we have a limitation. We can do the research work, everything, but advocacy is lacking from our side. We can make the presentation during the workshop meeting, but we cannot approach the authority directly. So that is why there is a role of everybody. Every organization is there, CBOs, NGOs, technocrats, everybody. It is my responsibility to invite Dr. Gupta to make a presentation of secession. He's the best person in the country, because I have heard so many times to Dr. Gupta. I'm talking about Dr. Gupta, Rajasthan. He is a very good speaker. He has a control over English and Hindi language both. And because of that, he is the best person to motivate the client. And hope one has to identify, as a trainer, one has to identify who is going to train to whom. Then tobacco-free panchayats raising the issues in District Tobacco Control Committee. Who is going to raise the issue in District Tobacco Control Committee? It is the NGO representatives, they raise the question. The nodal officer cannot speak in front of the collector. The nodal officer cannot speak in front of the other officials. If SP is sitting, just he or she can request, sir, ye ho jana chahiye. Sir, can you do this? But he cannot give an entire, he cannot do the SWOT analysis in front of the collector. That is the limitation. So we continue with the next slide. Next. Now, we conducted a series of programs for last 10 years, 1 decade. And most of the time we were stuck. The trained person has been transferred. The trained person has been transferred.
Hello.
The trained, hello.
Hello.
Hello. The trained persons were transferred. So later on, we decided to train the new officials. So in Madhya Pradesh, we started this. The result is very good. We are conducting a series of programs in the administrative academy, where new officials are inducted, whether it is from the state service or from the Indian Administrative Service. Number one. Then newly recruited officials of administration, Academy of Administration. Then police academy is there. We are conducting police training program, and in the judicial training also we are holding. This has brought a lot of result, because the person who has been trained in the police academy, he or she one fine morning, he or she becomes a SP of a district. Since he has gone through the initial orientation at the academy, then it becomes very easy for us to motivate them and to implement the entire tobacco control program. So this innovation we have brought in Madhya Pradesh, and now this tobacco control program has become a part of course content of their training program in administrative academy and police academy. Judicial academy, it has not taken till date, but police academy and administrative academy has incorporated this tobacco control program in their ongoing training programs. Next. This is also equally important. In government sector, the directives from the boss is equally important. If there is a directive, next. If there is a next slide. Next. If there is a directive from their boss, the participants will participate. Government, I'm talking about the government officials, will participate in a highly disciplined manner. Otherwise, they will participate for the sake of participation. So whenever we conduct any training program, we get the official orders for the participants of their respective department, whether it is a police, corporation, or everything. It is not we invite only as a chief guest, but is the involvement of the officials is there. Next. Next. These are some of the orders which I wanted to give. Next. Next. These are some of the photographs of the academic administration and police academy, and this is incorporated. Next. What is the immediate output? If you conduct any training programs, the immediate output is you transfer the knowledge and skills, addition to the participants. You will observe that there is a change in their behavior also, their attitude and behavior also, if the training is effective. If only information dissemination has been done, then there is a less possibility of behavioral change. Then improvement of performance is there, proper utilization of resources is there, and multiplication of tobacco guards in the community. These are the immediate output of the training programs which we are conducting. Next. The biggest challenge, ma'am, Mira ma'am, the biggest challenge with the trainers, first, you keep yourself updated. Any trainer in the state, always keep herself or himself updated.
Yeah.
Because you don't know at what time who is going to make a telephone call to you. Anytime, any moment, you get the call from the enforcers. अब क्या करें, दुकान में चले गए हैं. VFCs, organizers, implementers. Anytime, any moment, you get the call from the officials. Trainers, they get the call from the officials, because the officials, they understand the trainers, they know everything. They are the champion. You get the information from the trainers. So trainer has to be, the trainer must keep themselves updated. Otherwise, your entire effort will be diluted in future. Then keep plenty of educational and awareness materials. If you are a trainer, you keep everything ready, presentation or clarification, FAQ. More than 40 questions are there, practical questions are there. I'll quote you one example. If an enforcement squad, there are 4 members in the enforcement squad. One is the sub-inspector. Second is the drug inspector. Third is the food inspector. And fourth is the district nodal officer. They decided to go to check one shop, and the nodal officer gave the consent. Okay, fine, at 3:30 we all will reach there. The all sub-inspector, drug inspector and food inspector, all three reached there, and nodal officer did not turn up. And telephonically he said, okay, fine, karwai kar do, whatever you want to do. Now, who will be the next person to do the karwai? Who will be the next? Because this was not said during the training program. Who will be the next person? I'm giving you a live example. The drug inspector will not impose the Section 77 of JJ Act. The food inspector, the answer is that legally, the answer is that the next senior person can lead the team. Now, there's another problem I'll quote you. If the next senior person is a food inspector who joined in the year 1979, and rest of the two drug inspector and another staff who has joined in 1980. But government has a different meaning. Since the food inspector's basic salary is less than the drug inspector, although he has joined 1 year before, but he is not the senior person. Then what to do? So this type of training is required. We are holding only bare act orientation, COTPA 4, COTPA 5, as per the COTPA 4, this is prohibited in public place. As per the Section 5, this is. Skill training is very, very important in these days now. So anytime, any moment, keep plenty of educational measures, sustain motivation and willingness among top policymakers. If the policymakers are convinced, if the top authorities are convinced, you can sustain the process. Next is the last slide, mate. What through this exercise, the result we have seen is the NTCP program has been institutionalized. I'm not saying we have done advocacy at the Bhopal level. The officer which were trained at the Academy of Administration, the officer which were trained at the Police Academy, while going back to their respective districts, they themselves have formed the committees, official committees. This is known as a sustainable model. All the time you are not, because we don't have such resources to travel all 52 districts. So what is important is to sensitize them and train them. Then enforcement mechanism has been strengthened. Earlier we were collecting only 35,000 rupees. Now last year itself under Section 4 only 16 lakhs rupees. It's not the money. It's a number of people have been charged because they have charged only 15 rupees, 20 rupees. But still is going on. 3 days back they have captured more than 5 trucks having this without pictorial warning brands were there in the truck. And the biggest problem is that the truck owner is saying that truck owner has not turned up for last 10 days. The driver is saying कि मुझे तो बोला गया था सामान ले जाओ, I am not aware कि cigarette is there. Ab now GST department is fighting, police department is fighting. Then another health department has been asked to declare it is a tobacco product. Cigarette is already there. Why to? They said the administration is saying कि आप एक certificate दे दो कि इसमें tobacco product. The health wala saying कि no, हम already cigarette का डब्बा है तो why I will say कि tobacco product है. आप अपना charge कीजिए, illegal है. So laws related, other laws supporting to COTPA, this training is also very, very important, which we have started in our state for last 1 year. Other laws which is supporting to COTPA, because COTPA is not a very strong social law. It's a very simple law. And our purpose is to protect the new generation. Our purpose is to protect the youngster, adolescent. So awareness, monitoring and enforcement, all three should go together, and all three will go together unless you provide a good quality training to these people. This is all in nutshell I wanted to share with you. There's another meeting also, ma'am. Thank you so much. Thanks a lot.
So, thank you, Mukesh ji, for knowing us about your own personal experience. And I'm just reminded of my days as a state nodal officer. So we have been doing it all, but you have been very articulate and very meticulous in compiling all the activities. So thanks a lot. So before asking Dr. Mira ji to give her concluding remarks, I'll like to acknowledge the presence of Dr. Rakesh Gupta from Rajasthan Cancer Foundation, Dr. Ram Prashad, and Dr. Shrishti Rai, Dr. Kalpana Rai. So they are all present, and thanks for being with us. Thank you. And Dr. Rakesh Gupta, you were giving some brief comments about his presentation. Can you say yourself?
Thank you very much. Good evening, everybody. And I think it has been one of the very nice and comprehensive presentations. Mukesh ji has immense experience in organizational procedural runnings and capacity building at all levels. So I consider him as one of the champions in providing the capacity building for all different types of organizations, and he has covered it very nicely. I think these are two questions, perhaps very brief, I wish to ask. That media personnel have not been included here in your training. And although the reciprocity is there that you also learn from media, so where would you put media, whether you will include them in capacity building for NTCP and POTPA enforcement or not? And secondly, I felt that we do talk of empowerment. So where do you see empowerment in your continuum of the different types of training, capacity building, capacity strengthening, etc.? Two brief questions.
Yes, sir. The first question is very, very important. I frankly acknowledge that we did not do any exercise for the media. We used media only for the press note or something. But later on, after 10 years, we realized, that their sensitization is equally important. We were using media in all the other things and everything just to get the place in the newspaper or news channels or everything. So this is a very, very important. You have given this idea, and we are planning to discuss, start this media orientation program also, in which, and I'm sure for media orientation, we require a very strong person who has a command over who has a capacity to orate them. Media personals, they want orator, somebody who can orate them.
So Mukesh ji, I think Deepak is the right person for this. Deepak Mishra.
No, Dr. Gupta, Rajasthan.
Yeah.
But Deepak is a campaigner.
He's a campaigner.
There's a difference.
Okay.
There is a difference. We require people who can orate them. And oration can be done only if you have a good vocabulary, if you have a control over your language, and you have understanding about the subject also.
Then maybe Dr. Rakesh Gupta from Jaipur will be helpful here.
Yes, he's there. And second question, what empowerment? Empowerment is a long process, sir. It is not you cannot get a person empowered within 24 hours or 48 hours or attending one meeting. The empowerment is going on, and of course the process is slow. I will not say that the people are not empowered, but the process of empowerment is slow because lots of other factors are there. Somebody, suppose officer which has been highly trained, and one fine morning he has been transferred to some different departments, and he is badly stuck in their departmental affairs. Although he is an empowered person, but unable to react. So that's a long exercise, sir. Dr. Saab, it's to empower a person. You have to conduct a series of programs. You have to develop the dialogue with the individuals. You have to do one-to-one one-to-one method is also a part of empowerment, especially with the policymakers.
Thank you. Thank you. I must also appreciate the kind appreciation you have given. I do not deserve that. I am still a student and keep learning from you all. So, in all humility, I don't want to over-inflate.
I'm expecting from two persons, you and Dr. Gupta, both of you are champion in the secession center also.
We have Dr. Mira Aghi already our mentor. So.
NPVHA is planning for the training of the secession also.
Great.
Okay.
I'm also planning to invite both of you.
Thank
but
you.
The training will be in Hindi.
Yeah.
MP is a Hindi state, so we are planning in a batch wise.
Mukesh, we are actually planning a program for non-medicals also. Okay. So maybe very soon with Hriday. So Dr. Rakesh Gupta will of course be with us for that training.
And I would I would like to train all my employees. 120 employees are there working.
Oh, that would be great. Yeah. So we have a good cohort with you then. Thank you.
Thank you so much. There's another meeting also.
Okay. So Sanchika ji, I'll request you to please invite Mira ji for her concluding remarks.
Thank you, sir. Now I would request Dr. Mira ma'am for her concluding remarks. Over to you, ma'am.
Thank you, Sanchita. I think that actually the concluding remarks that I had are already spoken about by Mr. Sinha himself, and also Rakesh has repeated many things, and so has Rakesh Mahajan also. But in any case, what I want to say is that the presentation is in very much details and to the last point. And I think that Mr. Sinha has tried his best to clarify how things are different. How do you train a politician as opposed to a law enforcer? Or how do you train, let's say, how do you train the people who are actually doing the work in the field, as opposed to those who have just to speak things like the politicians or something. And I think that what is very important for me, which he included, was that all his talking was from the point of view of how different people are to be trained by involving them into what is right for them, And my contention has been that whatever we are planning, whatever intervention, whatever policies, whatever training we are intending, the people to whom this is going to be imparted have to be involved. Not only from the point of view of asking them, but from the point of view of their profile, from the point of view of their contacts, from the point of view of how they interact with people. So, and this Mr. Sinha has kept in mind very well, and I appreciated that very much. And I think that even all of you listening, including the students, I think should be able to appreciate how he has devised things according to the people who are being trained. Yeah. Thank you.
Thank you, ma'am.
So now, thanks, Dr. Mira ji, for your concluding remarks. And I now request Dr. Sanchika to propose vote of thanks.
But I was, Rakesh, I was wondering if we can ask Mr. Sinha if he thought I said the right thing. Maybe I didn't understand very well.
Haji Mukesh, any final comments?
No, it's all right. I'm really thankful to all of you. And Mira ma'am के सामने क्या बोलना? Dr. Mira has motivated me. She is the only person in the country motivated me, and she said, go and talk to the tobacco users, poor users. And now I have started going to the slum area, talking with the women, talking with those who are midwives working in the homes. They are using the tobacco. So I'm just trying to understand why they start. It's not only the advertisement. So this we have started with her guidance. So thank you so much. Thanks a lot, Mira ma'am, for your guidance from time to time.
Okay, it was so nice to spend the whole day with you.
Yeah, thank you. Thank you so
Thank
much.
you.
So we have headed towards the last minute of the session today. A very big thank you to our guest speaker today, Mukesh Sinha ji sir, and our chief guest, Dr. Mira Aghi ma'am, and also our participants who have joined, plus subject matter expert who were there with us in the last sessions, like Dr. Rakesh Gupta from Rajasthan and Dr. Ram Prasad also. I'm seeing the same faces again, and we will meet again in the next session. I would like to talk about the next session, which is on 11th of October. The topic is TBL experience across various states in India, and our subject matter expert is Dr. Nidhi Sejpal Foran. So we'll see you again on 11th of October at 4 p.m. Wednesday. Namaste. Jai Hind.
No,
Thank you so much. Thanks a lot.
Thank you.
thank you so much.